So we've got one from Ashley in Karatha. Hi, Ashley. She asks, is there any truth to natural induction methods? I'm 39 weeks and going absolutely crazy. I just want this baby out. Does this sound familiar or what? I think every woman within the last few weeks starts going a little stir crazy, for lack of better words, cabin fever, and they're ready to just about do anything to get the baby out. Really important before I go any further to say that as much as I can empathize, because I was in the exact same situation as you, now that I know better, I do better. So when I was at probably 39, 40 weeks pregnant, I was so excited. I wanted to meet my baby at any cost, and it was a little bit crazy. So I did something like castor oil, clary sage, abdominal massages, jumping jacks on the beach, I mean, you name it. And what ended up happening is I set my body off on the wrong start. So I went into early labor, an early intense labor, which gave me a 45-hour prolonged labor, which was really, really challenging for a million reasons. So important to note that although there are natural induction methods, whether they work or not, we don't know. You do run the risk, of course, of forcing your body to perform under pressure and do something it's not ready to do. You can throw a train at a pregnant woman. If she is not ready to go into labor, nothing will make her go into labor. No amount of drugs, no amount of jumping jacks on the beach, no amount of having sex like a rabbit or eating a bag of chilies and carving 10 pineapples. Nothing will make a difference. However, lots of chocolate and lots of sex is awesome in general. So I do suggest it, but I wouldn't count on those natural induction methods. Enjoy this time to relax, enjoy being pregnant, because I can guarantee you $1 million that after you deliver your baby, you're going to be missing that cuddly, kicky, awesome feeling. Thanks for your question, Ashley. Tiffany from Melbourne. Hi, Tiffany. Tiffany asks, how accurate are due dates? Tiffany, this is an awesome question because I get asked this as well all the time, and I have a few women panicking about it. Oh my God, my due date's in 2 weeks, or my due date is in 2 days, my baby's not here. First of all, take a step back, ladies. Due dates are about as accurate as forecasting when it's going to rain in the next 3 months. It's just not going to happen. You're putting pressure on yourself for absolutely no reason. Birth is an unpredictable, wild force of nature, and if you try to put it in a box, it's just going to disappoint you. So remember this, due dates are as accurate as a scanning method. So scans are not very accurate, and as such, your growth can't actually be predicted as much as you can. So you can go anywhere from 2 weeks before your due date to 3 weeks after your due date. There's some countries that use a due month principle, which is a lot more relaxed approach, and which means that instead of, really focusing obsessively on when your baby's coming, you can just kind of, go with the flow and let things happen. I wouldn't put too much stress on when baby's going to come. You just have to have faith that your body is cooking up your baby just right, and that your baby is going to make their appearance when they deem it's the right time. Doesn't matter who's telling you that Bubba needs to be out by a certain date. Trust your instinct, trust your physical cues, and just keep going with the flow. So your due date can actually go up to 43 weeks, up to 44 weeks. Just go with the flow. That's my best advice. Thank you for your question. Zoe from Darwin. She has a work-related question. Hi, Zoe. Dear Womb Warrior, your job looks really cool. What does a doula do, and how can I become one? Thank you, Zoe. My job is pretty cool, if I must say so myself. There is a lot I can say about this, but before you look into becoming a doula, it's really important to weigh out the pros and cons, the lifestyle, and see if it works for you. I really recommend talking to other professionals or people who work in the industry, because it can be a very emotionally taxing, confronting lifestyle, but it is so worth it. I find no greater pleasure than supporting a woman through any choice she makes in any setting and seeing her feel fully supported physically and emotionally through the entire ride, all the way till after she delivers her baby. You can do things like childbirth education or lactation consultant, postnatal doula, anything you can imagine. It's a really lovely industry with a lot of potential. It's just about exploring it and see what works for you. We actually do have a birth worker session coming up. I know you're in Darwin, but this is for everybody else in the Perth area, in Fremantle at the Nest on Silas Street, and that's run by Abbey, who's a midwife in town. And what we're going to be doing is covering all of course option details, have a live Q&A, and help people who are considering a career in this industry to kind of get a better feel of what we actually do, what it's about, and how they can go ahead getting involved. So if you are interested, hop on over to our website at www.wombwarrior.com.au to book your spot at this session. And if not, we're hoping to take these to the rest of the country within the next few months. Do some Google, do some research, talk to some friends. You will not regret getting involved in birth. Women, babies are the coolest thing I've ever been involved with, and it's always a pleasure. Thanks for your question. So we've got a question from Melanie from Midland in Perth, and she asks, I'm booked in to see my OB or midwife on my estimated due date, and they are offering a stretch and sweep. What is this? Everyone I know is getting one. Do I need to get one too? All right, Melanie, this is a good one, really relevant because I get asked this all the time. Let me just clarify that I do not pretend to be a doctor or a midwife or a medical professional, but I'm just giving you the facts. So a stretch and sweep is actually an irritation, and it's where the doctor or midwife passes their finger between the cervix and the membranes, and it's meant to irritate it to get things going. So, to kickstart labor. It is really beneficial to you as a consumer and a patient to always be asking the benefits, the risks, and the alternatives in any situation or any kind of intervention that's suggested or a procedure that's recommended. Really, really important to ask. Just because everyone else is getting one doesn't mean it's relevant to your situation and doesn't mean that you should be getting one too. So do the research, see if it works for you, and then make a decision based on evidence-based research and whatever makes you comfortable. There is risk to it, obviously, and this is premature rupture of membranes, you're introducing the risk of infection, etc., etc. But for some reason, it's really popular amongst everyone, but that's your decision to make. Thanks for the question, Melanie.